Hello and welcome. We are giving a presentation today on skin wounds and how they affect the homeless in San Joaquin County. Presenting today are
Natalie Sherratt,
Raquel Holbert,
and Christopher Stabork, and we're nursing students at San Joaquin Delta College. Thank you. So the topics we'll be covering today include homelessness statistics in the county, an overview of skin wounds in general, and then going over the common skin wounds among the homeless. Also, we'll be talking about the complications of those skin wounds that can happen, local health resources, community benefits, ways to give back, and then we'll summarize what we went through. Thank you. So to start us off, let's talk about homelessness in San Joaquin County. There are currently, as of the census in 2019 that was done, approximately 3,000 homeless people throughout the county, and about 60% of them are unsheltered, which puts them at increased risk for health problems due to exposure to the elements and also not having a stable, healthy food supply. Thank you.
So type of skin wounds that you guys might be familiar with are listed on this slide. Our skin is the first line of offense, and it's also the largest organ of the body. So some wounds we see that are common are scrapes and abrasions, which are like we're at risk for infection. We have cuts and lacerations, which are deeper, bruises, which are more superficial, ulcers, again, risk for infection because of how open the wound is, and avulsions, which are traumatic tearing away the skin, which we see with our finger on the second or on the picture in the bottom, and that's when the tendons and ligaments are torn apart. Thank you.
So we're going to get down to it. Most common skin wounds among the homeless are going to be as follows. Intravenous IV drug use injection site wounds, venous stasis ulcers, and diabetic foot ulcers. Thank you. So the first one, intravenous IV drug use injection site infections. Skin infections are extremely common in intravenous drug abusers, with 11% of intravenous drug users reporting at least one abscess within the past 6 months. This is due to injection of drugs into the fatty layer under the skin, tissue death due to the toxic materials and drugs, and increased bacteria found on the skin. Risk factors are IV drug abuse, not maintaining proper hygiene, not using sterile needles, and sharing needles among users. Signs and symptoms include areas of redness, warmth, and tenderness, all leading to signs of inflammation. You'll see pitting and scarring, and bleeding can also occur. This is because the skin, venous, and lymphatic systems are damaged by the frequent penetration of the skin and consequent low-grade infection. To help prevent skin wounds, keep the skin clean and increase your fat and protein intake to increase healing. Sterilizing needles and cleaning the skin before injection can help reduce the possibility of an abscess forming, but these practices cannot prevent the effects of contaminants in the drug themselves. Thank you.
Venous stasis ulcers. Our venous stasis ulcers are caused by insufficient valves in the legs due to venous reflux, which is venous hypertension. So there is a rise of blood pressure in the veins. The limb is filled with blood that can't return to the heart, which forms an ulcer. So we're seeing like deposits of proteins, like in that seep out of the veins and blood and into the interstitial subcutaneous tissue, which causes edema. Those tissues eventually begin to die from lack of oxygen and nutrients. So the people at risk here, we have people with diabetes mellitus, CHF, congestive heart failure, peripheral vascular disease, deep vein thrombosis, pregnancy, and also obesity. So signs and symptoms are irregular shaped wounds, shallow, red at base with exudate, which is like drainage, dull pain in an affected leg, and swelling around the infected site. So we're gonna feel like an achy feeling when we have this type of wound. Treatments are prescribed antibiotics, keep them clean. There's certain ointments we can put that are topical, anti-topicals and antibacterials to help infection. Also, a compression therapy. We can debridement or maggot therapies to clean the wound out of any like the white blood cells that form and dead blood cells. We also can do a skin graft. Prevention is smoking cessation. We want to live an active lifestyle. We want to maintain a healthy BMI, and we want to wear compression socks to prevent this from happening. The number of venous ulcer cases per year are in the US is estimated to be around 600,000. Thank you.
All right, so the next and the third common skin wound among the homeless is diabetic foot ulcers. So risk factors for this are diabetes and the associated neuropathy, which is lack of feeling in the feet or other extremities, peripheral vascular disease, which has to do with the veins not working properly, age 40 plus, and then smoking, and as well as care issues, so which is socks and shoes not fitting properly, walking barefoot on hot concrete, or sleeping with your feet uncovered on a cold night. So what happens is you get a soft tissue injury to the foot, which could be a cut or scratch or just a rock in your shoe. It's going to rub against you, and then it's going to get bacteria that go inside, and it causes an infection. Also, dryness of the foot can just cause a crack, and that can also lead to the ulcer. So it's multiple factors acting together. Thank you. And so the statistics for foot ulcers, about 1 to 4% of the US population gets a foot ulcer each year, 5 to 10% of those who have diabetes. And then among the homeless, about 2/3 of the homeless tend to have a foot health concern, and only a quarter of them actually address the health concern with a care provider. So the treatment of these diabetic foot ulcers is going to be antibiotics, bed rest. If it gets worse, there's the dead skin needs to be cut out, or dead tissue. And in severe cases, you can have amputation, especially if it reaches the bone. Prevention of this is going to be avoiding hot and cold temperatures for the feet, wearing closed-toed shoes at all times, checking your blood sugar, especially if you're diabetic, inspecting your feet, washing them, cleaning them, and applying lotion, and trimming your toenails straight across. Thank you.
So complications of unmanaged wounds is what we're gonna see in patients who aren't seeking treatment right away. So first, we can see cellulitis, which is a bacterial skin infection. The common strains that cause this infection are strep or staph. Also, we're going to see red and swollen and warm to the touch as far as in symptoms for cellulitis. Another thing we can see is an abscess, and bacterial infection leads to buildup of pus and fluid. This is also going to cause a red and swollen area as well as warm to the touch. In addition, we can also see gangrene as a complication that manifests as tissue death. That can lead to a loss of tissue or limb. We see it commonly in the fingers and toes. And lastly, we see sepsis, which is an untreated infection which causes systemic inflammation, which can lead to organ damage and death. So this is basically blood poisoning. For treatment, we can treat cellulitis with antibiotics. We can treat, for abscesses, we can treat them by making an incision, which would involve drainage of the abscess, which would drain the pus and fluid. This would also be an immature, we would also want to administer antibiotics with this wound. For sepsis, some of the signs we see with it are shortness of breath, decreased blood pressure, and elevated heart rate, and possibly delirium. And the treatment for sepsis would be IV fluids and antibiotics. Thank you.
All right, so we're going to get into local health resources. There's a few main types of resources available to the homeless community. We have free and low-cost medical clinics, food drives and food banks, and shelters. Thank you. We have the Gleason House Medical Clinic, the community medical centers, and the San Joaquin County clinics. All of those clinics provide staffing by medical and support personnel, and provides family practice, internal medicine, health education, nutritional counseling, behavioral health, laboratory and HIV testing, all at treatment at no cost to the homeless. Thank you. Now on to food banks. Listed on the slide are a few of the many sites doing donations. We have Bread of Life, Breakfast Club, and Emergency Food Bank. Thank you. And now we have the shelters. Two of the main ones are Stockton Shelter for the Homeless and New Hope Family Center, both of which are open at 24 hours. These shelters can include services like emergency shelter, case management, provide clothes and hygiene supplies, transportation for homeless people that have children so they can get to school. They have referral assistance, free drug testing, and a 12-step program enrollment. And then as far as benefits as taking advantage of these resources in the community, the proper medical care can prevent and treat pre-existing wounds. So if you don't have one already, let's keep it that way. But if you do, let's get it treated and healed up and prevent another wound. Food drives allow the homeless to access more nutritious foods, which aids in healing. Shelters and housing help protect from environmental factors that can affect wounds, like being in the hot or cold or being wet with moisture on the wound constantly. And just a side note, San Joaquin General Hospital will serve any and all patients regardless of background or financial situation. Thank you.
So ways we want to give back are, or a way we would love to give back would be having a community presentation, given it at like a local community center or even a homeless center. And these presentations would talk about the wound care interventions and symptoms of infection that we seeing throughout our slide, and just things we want to recognize when you need to seek immediate treatment, like going to a hospital. And then again, those like inflammation, discharge yellow and green, and warm upon touch, pain, disorientation, and just interventions and preventions to do for yourself at home would be just practice a good hygiene, washing your hands, eating good, and exercising, as well as proper footwear and frequent self-assessments and getting regular health checkups. Something else we would like to do for the community is doing a first aid kit supply drive. We have listed things like Band-Aids and rubbing alcohol that homeless people don't have easy access to, and we would collect these again in the form of a supply drive, and then distribute them for the homeless population who needed these things. Thank you. Also, Healthy People 2030. It's a government-run group aimed to improve the health and wellness of the American people. They set each year goals for a 10-year period. For each 10-year period, they set goals to promote a healthy and better us. So no objective was specific to skin wounds this year. And however, diabetes management is being addressed, and some of the skin wounds in this presentation are related to diabetic complications.
All right, so what have we learned today? We've learned what skin wounds are prevalent in the homeless community. We've learned that ulcers are the most common type, and there are a few of those, and that there are many complications with these wounds that can lead to serious illness and death. Also, we've learned that that early treatment is very important in order to mitigate this problem. People with wounds that become unmanageable need to seek health care, which is available to them in the form of free clinics and healthcare hospitals and places for them to go, as well as food drives and for nutrition and all. And then community involvement in the form of first aid and supply donations can really help to improve outcomes for the homeless. Thank you.
Well, thank you all so much for watching our presentation on behalf of the San Joaquin County Delta College Nursing Program, class of 2022.